Warren. May I have a roll call, please?
Mayor Bagwell,
Here.
Supervisor Giomi, Supervisor White, Supervisor Jones, Supervisor Schutte.
Here.
A quorum's present.
Thank you so much. We're going to move on to agenda item number 3, and I'm so honored to introduce Kyle Baker, the co-pastor at Life Point Church. And thank you so much for offering to do this morning for us.
Hey, thank you very much. I appreciate it. Thank you for your service. And I'm going to pray for rest for all of you. I know it's been a really challenging time, and it feels like sometimes you're doing twice the amount of work to get half of the work done. And so I want to pray for you guys, not only for wisdom, but rest for you and your families. And so I'm going to do that. Will you please join me in prayer? Father, we're grateful for these civil servants, from the construction workers to supervisor to the mayor to the office assistants and everyone in between. We pray that you give them and their families a time of joy and rest in this holiday season. We pray that you give them the wisdom to rest so they can make wise decisions. We're grateful for their leadership, for their compassion, for the desire to serve others. And we're grateful that we get to gather today to accomplish things that will help better our communities, our families, and the people under our care. In Jesus' name, amen.
Thank you so very much. You can definitely join the group. We're happy to have you back. Thank you. I'm going to, Mr. Giomi, since the other Giomi is not here, would you do the honor of leading us in the pledge?
I will.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you so much. I really appreciate that. We're going to move on to item number 5, which is our public comment. No one has signed in for any public comment. May I please, is anyone on the phone line?
There are no callers on the line at this time.
Okay, and no last call. And I have no public comment in the room. For those that are listening, I'd just like to let you know, in case you're interested in item 12B, which deals with the arts, we will not be hearing that item this morning, as it just needs a little bit more work to come back towards us. So we're pulling that item in case you were wondering. We're going to move on to item 6A, which is the opening of the public hearing. So if there's any public that, which I don't think there is because no one was just here for public comment, but we'll do this technically. For the proposed issuance of the general obligation water bonds, the public hearing is open. We will give it just 30 seconds just to make sure there's no issue. Thank you so very much. The public hearing is closed on item 6A. We'll now open the public hearing on 6B, which is for any discussion for the public concerning the proposed issuance of the general obligation capital improvement bonds for $8.1 million, and this is for acquiring, constructing, improving, and equipping building projects. And so we will open that item. We'll give it, again, just the requisite time. And I don't see that there's any comment on this item, so we will close the public hearing on item 6B. Thank you. We are now on to the approval of our minutes. We have 2 sets, November 4th, 2021 and November 10th, 2021. The November 4th minutes, a typo correction has already been submitted and corrected by the clerk. Are there anyone have anything? And if you want, there was also a small double the corrected in the November 10th minutes. If you want, I'll accept a motion then to approve them both as corrected. Supervisor Jones?
I move to accept the minutes as presented.
As corrected. Okay. Do I have a second?
I second.
I have a motion for the approval of the November 4th and November 10th minutes as corrected. All of those in favor, please say aye.
Aye.
Aye. Any opposed, say no, and 1 absent. So we have 4 yeses and 1 absent. Thank you. Okay, we're going to move on to our consent agenda. Is there any items anyone wants to hear? Seeing none, I'll accept a motion for Approval of the consent agenda as presented. Supervisor White.
Approve the consent agenda as presented, consisting of items 8A, 9A, 10A, 10B, and 10C.
Do I have a second? I have a motion and a second for the approval of the consent agenda. All those in favor, please say aye. Aye. Any opposed, say no, and one absent. Thank you. Okay, we're now going to move on to item 12A, which is discussion and possible action regarding the appointment of 2 members to the Audit Committee for a full term ending December of 2023. We'll start first with the disclosure. Mr. White?
NRS 281A.420 requires me to disclose a conflict of interest and abstain from voting when I have a disqualifying conflict. In my private capacity, I serve as Vice President of the Nevada State Prison Preservation Society. Jim Wells, who is seeking reappointment to the Audit Committee, serves as the President of the Nevada State Prison Preservation Society. Aside from our service to the Nevada State Prison Preservation Society, I do not have further personal or business interactions with Mr. Wells. While I make this disclosure, the judgment of a reasonable person in my position would not be materially affected by my interaction with Mr. Wells, and I will be voting on this matter.
Thank you so much. It's my understanding that John Karg has declined to interview and removed his application for consideration. So just in general, in case the public, Mr. Wells filled an expiration of a term. So generally speaking, we automatically give them their full term when they're so gracious to do these 6 months for us and things like that. So we do not need to interview Mr. Wells. He's previously been interviewed. Is Ms. Duke here? Hi, if you just want to come up briefly, because again, Mr. Karg has taken his out, so I'll just ask you a general question and introduction. And so excited to see that I see from your resume that you're a CPA.
Retired CPA.
That's okay. That means you have time to help us. That's
Yes.
important. Okay.
Definitely.
So, Ms. Duke, if you would please do us the honor of identifying yourself for the record, and then just tell us a little bit about why you'd like to do this.
Yeah, my name is Bonnie Duke, retired CPA, haven't worked for about 3 years. Is it on?
It's on.
I'll speak up a little bit.
Thank
That
you.
better? Okay. Yeah, I have been out of the work world for about 3 years and just kind of think I still have a little bit to give and would like to give back to the community in a way that I know something about that maybe most people don't know much about.
It would be accurate. It's probably one of our most difficult committees to fill because
Yeah.
it definitely takes a certain skill set to,
Yeah.
one, to enjoy it.
Yeah.
Most people look at the spreadsheets and go, I don't want to do this.
Yeah.
So we really appreciate that you want to serve and we can put you to work quickly. So
Okay.
does anyone have a specific question or anything or we can just move on? Thank you.
Thank you.
Yeah, okay. Well, with that, Ms. Duke, since we, again, only have 2, I'm willing to accept a motion.
All right.
Okay, Ms. Schutte.
I move to appoint James Wells and to appoint Bonnie Duke, each to fill a term expiring December 2023.
I have a motion and a second for the approval of Mr. Wells and Ms. Duke. All those in favor, please say aye.
Aye.
Aye. Any opposed, say no, and let the record reflect 1 absent. Thank you so much, and welcome to our team. And again, thank you so much for
Yes,
agreeing
thank
to
you.
do this. We really need you. Thank you. Okay, we're going to, as indicated previously, item 12B was pulled, so we're now on agenda item 13A, which is discussion and possible action regarding our interlocal contract between the state through the Department of Health and Human Services and our Carson City Fire Department for our Medicaid payments. Good morning, Sean. How are you? Great. Wanna give us
Good
a-
morning, Sean Slayman, Fire Chief. What we're asking today is to enter into an interlocal agreement with the State Department of Health for ground emergency medical transport reimbursement. What GEMT is, it was authorized in Nevada in 2017. It's a federal Medicaid supplemental reimbursement to public agencies that transport, ambulance transport. Carson Fire has been in the program since its inception in 2017. The supplemental reimbursement gets us, Medicaid has a fixed rate of reimbursement, which is significantly under what our ambulance rates are and what our true costs are, and so GEMT helps bridge that gap. The only cost to this is taken out of the actual reimbursement funds, and it's a little over $8,000 for auditing through the state processes. So on average, we're averaging about $1.2 million in reimbursements. Prior to the entering into this interlocal in 2017, we averaged anywhere from $300,000 to $500,000 a year, where we had to have a true up out of the general fund to subsidize our ambulance program. That is no longer the case in the ambulance mostly through the GEMT program.
And it's also now afforded us the opportunity to buy equipment, very necessary.
It has, the
equipment.
funding.
So it's really a good federal program that allows us to get more reimbursement.
Absolutely.
Does anyone have any questions? Supervisor Schutte?
So from what you just said, so in addition to reimbursing to bridge the gap of lost revenue, it can now actually be used to purchase.
Buy an ambulance,
That's amazing.
transport, right, things that fit the program.
Correct. It goes into our EMS enterprise account. So anything emergency medical related, it can be used for our purchases and ongoing costs.
Thank you.
It's really been a successful
It has.
program
It
for
is
the
a great
residents.
program for us.
So if I don't have any further questions, Supervisor Schutte, a motion, please.
I move to approve the interlocal contract as presented.
Second.
A motion and a second for approval of the contract. All those in favor, please say aye.
Aye.
Any no, say no. And let the record reflect 4 yeses and 1 absent.
Thank you.
Thank you so much. We're now on item 14A, which is discussion of possible action on our proposed collective bargaining agreement between Carson City and the Carson City Employees Association. Ms. Bruchetta, just a high-level summary, please.
Mayor, I was going to go ahead
Oh.
and do that one.
I'm sorry, Nancy's on this one and Melanie's on the next one. Go ahead, sorry.
That's okay. I'm pleased to present the proposed collective bargaining agreement between Carson City and the Carson City Employees Association. The negotiating teams were able to negotiate an agreement through June 30th of 2026 with an estimated fiscal impact of $1,844,319 for the term of the agreement. Just some of the changes from the current agreement include cost of living increases. They were set at a max of 2% annually, and beginning on July 1st of 2022, merit increases will be a flat 3% for performance ratings of meets expectations or better. Increasing standby pay from 10% to 15% of base salary. Annual sick and health insurance benefits were adjusted to be consistent between across bargaining agreements with the city, and the addition of language that eliminates the ability of a grant-funded or special-funded employee to bump if layoffs were instituted by the city. And then lastly, we just made changes to various job descriptions and grades and removing positions that no longer exist. So I just want to thank everyone that was part of the negotiating team. I know they did a lot of work and they did a great job. So I'm just recommending approval of the agreement.
Thank you so much, Ms. Paulson. Is there anyone representing the union that would like to say anything? You're a party to the agreement, so you're most welcome.
Thank you for the opportunity to speak, Ms. Bagwell and members of the board. My name is Uriah Wise. I'm the CCEA president, and I want to thank everybody on both sides of the table that came together to work this deal out. There were some ups and downs on both sides, and I feel real confident about this agreement going forward. And I hope that you guys feel confident with it as well.
Thank you so much. Please let the members of your union know how much we appreciate their good work too. I think oftentimes when we're in negotiation, it's a different stance for both sides, right? But please let them know how much we appreciate all their hard work for many years. We couldn't do it without you great employees, so please share that.
I will, thank you.
Okay. Any other questions or anything from the members? If not, I'm ready for a motion. Supervisor Jones?
I move to approve the agreement and to authorize the district attorney's office to make any necessary revisions that are clerical and not substantive when finalizing the agreement.
Do I have a second?
I second.
I have a motion and a second for the approval of the agreement and to authorize the DA's office to make the necessary revisions that are clerical and not substantive. All those in favor, please say aye. Aye. Any opposed, say no. Please let the record reflect 4 yeses and 1 absent. Thank you again, all of you, for your hard work. Like you said, all sides had to work to get this to happen. So good job. It's great for the public and the employees. Thank you. Okay, we're going to move on to item 14B, which is discussion and possible action regarding the proposed resolution setting forth the employment benefits for the unclassified city employees. Ms. Bruchetta, please give us a summary of that.
Good morning, Melanie Bruchetta, Carson City Human Resources Director. The action today is to amend the unclassified resolution to have it mirror what was just adopted in terms of the CCA labor contract. And the 2 changes are a 1% cost of living in January and then a 2% cost of living July 1st thereafter until the end of the CCA contract. And then the other change is to the merit increase system, eliminating the different merit increase percentages and going with a flat percentage of 3% for a performance review of meets expectations or above.
Does anyone have any questions? Seeing none, I need a resolution on this one. I'll accept a motion.
I move to adopt resolution number 2021-R-37.
I have a motion and a second for the approval of resolution number 2021-R-37. All those in favor, please say aye. Aye. Any opposed, say no. And let the record reflect, it's 4 yeses and Supervisor Giomi absent. Thank you so much. Again, everyone, good job. Okay, we're going to move on now to agenda item 15A, discussion and possible act. I'm surprised we're not doing a picture because this is a monumental moment. So again, thank you all so much. Really, it's effort, lots of effort. So discussion and possible action regarding a determination that BJAC Corporation is the lowest responsive and responsible bidder for a Liebherr 776 bulldozer. Does any member of the board have a question on this item?
Nope.
Seeing none, I'll accept a motion. Supervisor White.
I move to award and approve the purchase authority as requested.
I have a motion and a second for the approval. All those in favor, please say aye.
Aye.
Aye. Any opposed, please say no. And let the record reflect Supervisor Giomi absent, all through every item. Okay. All right, we're going to move on to item 15B, which is discussion and possible action regarding purchase authority for the 26 vehicles for several of our departments. This was all budgeted, and this is just the actual purchase of those budgeted items. I, in advance, also want to put on the record, thank you so much for reviewing each of those items to see if there was any opportunities and for working on a vehicle for the Parks Department and saving those dollars. So thank you. Does any Anybody else have any questions? Supervisor Shooty?
More of just a thank you. Thank you to Carol Akers. We spoke a lot about, the whole bidding process for this, the budgeting, and as well as the previous item, and I appreciate it. And Darren as well. So thank you. It's just really helpful having that deeper understanding of the whys and why it's done this way and the process. So.
Okay. Thank you so much. Supervisor White, a motion, please.
I move to approve the purchases as presented.
I have a motion and a second for approval of the purchases as presented. All those in favor, please say aye.
Aye.
Any opposed, say no. Record reflect 4 yeses and 1 absent. Thank you. We're moving right along today, aren't we? Okay, under item 16. City manager, anything to report?
I just wanted to say how amazing all the Christmas decorations look in the downtown going down Carson Street. And I just wanted to say that I had someone tell me that the Christmas decorations this time is her favorite time of the year to see Carson Street decorated like that. And she said she was so touched driving down Carson Street, she almost had tears in her eyes. So,
Me too.
and you're probably going to announce tomorrow? Okay.
Uh-huh. Okay, I do. I want to just remind everyone and invite the entire community and everyone at 5:30. We will be on the Capitol grounds with our festivities with the 5th graders. It's so wonderful when they start singing the carols. And then we will light up the Capitol and the grand, the grand reveal for our Main Street. This year, we did something different. We did the entire Main Street. So we hope that the entire community recognizes that we didn't just concentrate on the downtown this time. We went ahead and took those beautiful snowflakes all the way down through Winnie and all the way to the roundabout, so that the whole street is inviting. And I hope it really uplifts the community. And if you don't stop by and get a picture with a penguin or a polar bear or a reindeer, you're really missing out. So come and celebrate, and then come have some hot chocolate. The downtown, Life Point Church that was here earlier, they're supplying the hot chocolate. The Downtown Business Association will have some cookies. We'll have the penguins available for pictures, and have it on good authority that Santa's going to be stopping by with a nice bench, and the kids can talk to Santa if they'd like. So I hope it just starts our season off with joy for everyone. The deputy manager, Stephanie, did you have a comment?
Yes,
report?
thank you, Mayor. For the record, Stephanie Hicks, Deputy City Manager. I just wanted to update the board on some good news in regards to our business license renewals this year. Thanks to the efforts of staff, we are now 43% renewed as of this morning for the 2020 business licenses, 2022 business licenses. There were a lot of staff involved, but particularly due to the efforts of Michael Swanson from Information Technology and Natalie Keel from our business license group. And so I just wanted to thank them personally and also let you know that good news.
Does that mean we will not be asking for waivers this time?
So far, so good.
Wonderful news, wonderful news. Supervisor Jones.
Well, I'd like to acknowledge Ronnie Hannemans and the the redevelopment for their support in getting all the lighting on Main Street. It's very impressive. It truly is.
It really is, huh? I think we outdid ourselves. If I'm super honest, Ronnie and I were talking, because we certainly did pick the decorations, but it turned out even better. When you're looking in a catalog, you're guessing what it's going to look like, but I think Carson City has a proud moment for everyone to celebrate that, and let's just hope the spirits go with it, right? So thank you. Does anyone else have anything in item 16 to share?
Yeah, I just, next weekend as well, the holiday events with Homestead Holidays at Silver Saddle Ranch, Friday, Saturday, and Sunday. It should be amazing, and I rode my mountain bike out there the other day, and it's already decorated, wreaths and garland, and it's just so beautiful. And then, of course, the Santa train, Polar Express, all of that. So Carson City is a wonderful place to be year-round, but definitely during the holidays. And yeah, so anybody interested in learning more, carson.org, and everything's listed.
Thank you. Okay. Any special prison tours or anything? Going to be no dressed up convicts? Okay. Thank you so much. I just thought that could be fun, the
We're
Great
working on
Escape.
that.
Yeah. Okay. All right. I don't know. No one else. I don't see anything under this. We don't have a closed meeting today. Okay. Then we'll move on to the final public comment for the board. Is there anyone on the line?
There are no callers on the line at this time.
Thank you so much. Is there anyone in the room that wants to make public comment? No. Do we, just for announcement purposes before we adjourn, do we know the health? Oh, yes.
Sorry,
That's okay.
Can I make an announcement?
Yes, it's public comment, less than 3 minutes, go.
Okay. Saturday, Pictures with Santa for your furry friends or feathered friends at Benson's Feed from 9:30 to 3. And people have brought goats, pigs, horses, cats, dogs, chickens, and children. So, yeah, a great time. So that's something to include your pets.
Thank you so much. Okay, well, we're going to adjourn as the Board of Supervisors then. And we will call the Board of Health to order in probably about 15 minutes. So we'll be in an adjournment until the chair arrives. So about 15 minutes. Thank you. Miss Warren, is the recording system ready?
So I'll call this meeting to order and ask for the roll call.
Chair Lyons,
Yes?
Vice Chair Giammi, Member Bagwell,
Here.
Member Jones, Member Furlong, Member White, Member Shooty.
Here.
Quorum's present.
Thank you. Is there any public comment?
On the public comment, remember to ask if there's any on the phone too, so she can tell you.
Okay. Any on the phone?
There are no callers on the line at this time.
Thank you. So for possible action, approval of the minutes.
I move to approve the minutes of October 7th, 2021.
And I'm sorry, was that Supervisor Shooty?
Oh, yes, sorry. No, that was
Mayor Bagwell.
Mayor Bagwell.
Still learning the voices. Okay. Thank you. Do we have a second? All those in favor?
Aye.
Any opposed? Motion passes to accept the minutes. And then on to agenda item 22A for possible action, discussion, and possible acceptance of the health officer report. And this, the attachments went out with the original agenda. Unfortunately, my actual 2.5-page report went out as a late addendum. I want you to know it wasn't late, it just got sent over late.
Okay.
Although I did send it in a Macintosh document, which I always have to change over to Microsoft. So I'm just going to do some highlights. First, the letter that I sent to the Legislative Committee on Health Care. This is actually sent what I subsequently determined is probably the old Legislative Committee on Health Care, but nonetheless, they have influence on the committee that will subsequently be appointed. This was a bill passed SB 209, and part of it was studying the effects and the responses to COVID-19 in Nevada and making recommendations for Nevada's public health going forward in the future. And so I wanted to encourage that committee to be sure to seek the input of subject matter experts in Nevada, to include our county health officers and departments of public health throughout the state. And in those meetings, whether it be the State Board of Health or recently resumed monthly county health officer meetings, and we certainly have a great deal of expertise in the state, and hope that they will ask for that, being that there were boots on the ground and those boots were running during this long COVID battle, and we could certainly get highly valuable input and insights for that committee to share for the benefit of all Nevadans. So I forwarded that letter to them. I had a chance to tour the Carson City Jail. This was actually helped make arrangements for this by Jim Peckham, and had the opportunity to meet Dr. Elstrom and see how progressive the sheriff has been and the city has been in terms of having things like a fast team and just the jail. I mean, you know, that's always an interesting experience, something that the layperson doesn't have. And so very impressed with that team and our facility and all the progressive policies that we've enacted in the city. And we'll see today in our county health report that crime is not a big issue relative to some of the other counties for us. So that's great as well. Also continue to attend the Quad County Coalition meetings. These are monthly. I don't make every single one depending on what's happening. If nothing's happening, I go. This one was especially interesting. We have an incredible resource here in the city and the state regarding radiation hazards. And the big takeaway from it really is that a significant radiation accident is highly unlikely. So it's usually overblown because we've all been scared and we've all learned how to get under the desk and put our hands above our head for the nuclear bomb. And so it's really more hazard in imagination than in reality. But this is an interesting part of the handout that he gave, if you want to take a look at that in terms of just your own information with trucks that you'll see with the radioactive hazard warning signs on them, and a little bit about what that means. The Behavioral Health Task Force had a presentation by the Nevada Dementia Friendly Initiative. This is out of the Sanford Institute up in Reno. They specialize in geriatric medicine, and obviously that includes a great deal of emphasis on dementia. I've included the resource handout from them just as general information. This is going to be progressively more and more impactful for all of us as friends and family members of those suffering from cognitive impairment and or literal dementia. Clinical oversight, just want to point out we've had several public health nurse consults regarding latent TB. What does that mean? That's someone who tests positive for having been exposed to TB. They are assessed to see if they may have active TB. Are they actively infected? Is the TB microbacterium, causing a true infection at the time? Chest x-ray and review of symptoms. If not, then they're treated for latent TB, knowing that TB can sit and subsequently flare. So it can flare if you have to take a course of steroids for some type of illness or inflammation. That would include rheumatic conditions like rheumatoid fever, lupus, etc. Or should you need chemotherapy, which obviously suppresses your immune system. So there's a variety of medications out there for a variety of different conditions, or diabetes or renal failure and you're on dialysis. So it's been recommended for some time to actively treat. And I think what's happened is that I've really encouraged the public health nurses to recommend treatment, not to offer treatment, but to recommend treatment. And so I think we've seen a little bit of a jump in the number of people that we're treating because we're recommending treatment, which is the standard. So anyway, that's been interesting, some of those consults. It somehow dropped off here, that I also attended the Northern Nevada treatment cohort annual review, where they reviewed, I think, about 4 or 5 active cases treated in Northern Nevada. And this is a difficult illness and infection to treat. Because it takes multiple drugs. Those drugs have side effects. You've got to take them regularly. You've got to take them for a long period of time. If you stop taking them and then you go back to resume them, the bug may no longer be sensitive to that organism. It may be to that medication. It may be resistant to it. And so it was very interesting to see what is involved in the case management level of interaction with patients suffering from this, and the consequences of having to screen all of their contacts, whether those be at work or at home. So that was very interesting, and I was invited to that, thankfully, by Dr. Krasner, who is our kind of on staff, on call infectious disease specialist out of Reno, and he has done work as well with UNR. So my own training and education, attended the Western Association of Food and Drug Officials Conference. Most of what I was able to attend on that was the seafood production and safety. And interestingly, we did have a recent outbreak with raw oysters at 2 restaurants in our area. Both batches of oysters came from the same lot, from the same place, which was up in the Pacific Northwest. Those get reported up the chain at the federal level, and we didn't have any hospitalizations or anything, but we did have some illnesses from those exposures. Also attended, very interesting, my first FEMA training course on recovery from disaster. This was sponsored by the Nevada State Department of Emergency Management, and that's up at the Washoe County Training Center, County Training Center. And then in the report, just information about TB in general in the United States. And to note that the four states account for 50% of all the reported TB cases, and one of those cases is California. So we're right next door to a hotbed, whether that be San Francisco, Sacramento, or LA. It does tend to be in the larger cities where you're going to have the racial and ethnic minority groups, and these are usually non-US born. I do want to point out that there can be a Latina, Hispanic component to this, but often, for instance, the cases that we looked at for Northern Nevada, we have India, we have other countries, and the Afghan refugees are going to be impactful in some of this regard as well. So it's not just, shouldn't think of it as being our large percentage of Hispanic Latinx groups. And just to point out, as is always, the CNN investigation, tens of millions of filthy used medical gloves imported into the U.S. Very interesting that whenever there's a shortage of something, there's always a nefarious supply. And despite the potential risk to frontline healthcare workers and patients, and I think over and beyond others, because these are sold everywhere, U.S. authorities have struggled to get a handle on it, in part because import regulations for protective medical equipment were temporarily suspended at the height of the pandemic, and they have yet to be reinstated. Then on the handouts here, I think this is a really good one on COVID quarantine versus isolation. So quarantine is when you've been exposed, but you haven't been shown to be infected or ill. Isolation is where you're actually sick, okay, or you have a positive test even if you don't have symptoms. So these words are often used interchangeably, but from a public health perspective, they are different. And of course, they have different criteria as to what's recommended for the individual. And then just some information about pandemic fatigue. This is from the Public Health Collaborative, a nonprofit organization. And to just reiterate that we're all tired of it. Okay, my glasses fog up with my mask on. I can't see anything, can't read anything, can't see your face, even if you have a mask on. But public health measures are not the enemy. Okay, they are the roadmap to a faster and more sustainable recovery. And then questions about the CDC's reputation, and to know that the CDC remains around the world an agency that's trusted for a source of public health and health promotion guidance. And during the initial response, the CDC did not have the central and visible roles in coordinating and messaging as it had during prior ones, to include HIV, H1N1, which I remember when I was in private practice, Ebola, Zika, and that lack of a central science-based, forward-facing CDC role definitely created for mixed messages throughout the United States. The CDC has now been empowered to take a central role in developing, going forward, guidance, messaging, coordinating. And should people trust public health? Yes. Public health officials strive to be guided by science and independent of political and partisan considerations, and I certainly see that within our public health department and the staff that work for us. I mean, they have their opinions, their political opinions and sides, but they do take a very professional stance in moving forward. I wanted to also show this new Nevada Hospital Association weekly wrap-up, and to point out that staffing for our hospitals remains an alert, and it does throughout the United States. Supply shortages are also beginning to be reported by facilities for seemingly random and unrelated items, crutches, baby formula, and this is that whole supply chain thing. And there's other issues that are going on in China now in terms of they're not wanting to report where the ships are that are along their coastline, and this is going to further back up supply chain problems, et cetera, et cetera. So this whole issue is going to be an ongoing one. And then they are now reporting the county level COVID hospitalization data over a prior 2 weeks. This report was from a couple weeks ago, and Carson at that time remained flat, but we did have 25 people hospitalized for COVID. And lastly, there are 12 states, including neighbors, Utah, Idaho, Arizona, that have entered a lawsuit against the federal government to block the mandate requiring hospitals to vaccinate their staff. And certainly in a hospital situation, a nursing home situation, people are entrusting themselves to you, to your staff, that they're not going to go there and get sick. So I certainly hope that our staffs at our facilities will be vaccinated. And then there's a similar lawsuit against OSHA regarding the requirement that larger employers have their employees vaccinated. And then there's traveling nurses and price gouging to as much as $240 an hour for a nurse in a hospital. And the Hospital Association sat down with White House and urged them to investigate the price gouging of staffing agencies, and that has been supported by a bipartisan group of representatives and senators. So, lastly is that the Nevada Hospital Association put this out in September because of the staffing issues, supply issues, and the burnout being suffered by our medical personnel, that they really encouraged Nevadans to help out our hospitals by getting vaccinated, wearing a mask, not going to the hospital emergency to get tested, but rather using your urgent care centers and your primary care providers for non-emergent care. And that would conclude, I believe, my report. Any questions or comments?
I'll just comment. It seems like you've been as busy as all of us. It's a lot going on in public health right now, and I really appreciate you giving us a thorough update of what you see out there and what's happening. So thank you for your work and diligence in this matter. Thank you.
And I second that, and thank you for pointing out that, again, in the weekly wrap-up, while Carson City's numbers were flat leads to one, you think about, oh, flat, that's good, but 25 people hospitalized. That means 25 people, even if everybody is released and gets better, there's 25 people who have some huge medical bills. So just the effects of all of this are just ongoing.
Yeah, that's 25 people averaging every day for a month, because that's 2 weeks and then another 2 weeks, so yeah. And again, I'll just say that there was one study that says for every death from COVID, obviously from any death, there are 9 family and friends that are affected by that loss, whether that be socially or economically. Yeah. Okay. Is there?
I'll make a motion.
Yes.
You ready for a
Supervisor
motion?
Jones?
Motion?
Sure. Mm-hmm.
Thank you for your report, Dr. Lyon. I move to accept the health officer's report as presented.
I second.
All those in favor?
Aye.
Opposed? Thank you. The report passes. So item 22B for discussion only. This is, hopefully he's available. Okay. John Peckham is the Associate Dean for the Office of Statewide Initiatives at the University of Nevada School of Medicine. And Nikki and I having seen this presentation, Nikki asked him to provide us with the Carson City County health rankings and roadmap.
And for the record, Nikki Aker, Director of Carson City Health and Human Services. And I just want to say a huge thank you to him because he's actually on vacation and is doing this for us while he's on vacation. And Dr. Peckham has been very helpful to me in my role and is very helpful to public health. So, Dr. Peckham?
Good morning. Can you guys hear me okay?
We can hear you.
All right. Nikki, I think you have my slide deck.
I do, and it's up. I've got the title page.
All right. So thank you, Dr. Lyons and members of the boards for having me. As Nikki said, my name is John Packham. I'm Associate Dean in the Office of Statewide Initiatives at UNR Med up in Reno. I've also been past president of the Nevada Public Health Association and past president of the Nevada Tobacco Prevention Coalition. So while I have one foot in academic medicine and higher education, I've got another in public health, and kind of equally rewarding and complementary there. Next slide, please. Today I'm going to be presenting the latest iteration of data from the County Health Rankings and Roadmaps projects. This is it's 11 years in the making, supported by grant funding from the Robert Wood Johnson Foundation and data analysis from the University of Wisconsin Population Health Institute. But along with Carson City and Health and Human Services, you can see our project partners statewide include local health authorities, both schools of public health, the Nevada Public Health Foundation, among others. Next slide. For the past decade, the Rankings and Roadmaps project has operated with a model that has looked at a variety of health metrics ranging from health outcomes such as life expectancy, length of life, as well as, importantly, health factors that are driving those outcomes. And what they try to do each year is highlight the connection between factors such as health behaviors, social determinants of health, physical environment, and of course, clinical care that drive health outcomes. And one of the many things that this project attempts to highlight is the role of health determinants or factors that lie outside the walls of hospitals and clinical care settings. That clinical care and access to care, of course, is important. But again, the bulk of energy and focus in this project is, again, upstream. And again, what's driving those health outcomes, which we'll get into a little bit. Next slide, please. So in 2021, again, this data was released earlier this spring. And one of the things I love about this is that it gives communities like Carson City and other counties across the state the opportunity to see where they've made progress over previous years, where they stand among their other Nevada counties. I would also argue, and not to go off on a tangent here, the roadmaps also contains information on over 3,000 counties across the country. So it allows you to see how Carson City, for example, not only fares with other Nevada counties, but how Carson City ranks among like counties of population size and you know, the local economy and so forth. In 2021, don't shoot the messenger. I'm just sharing the data from the Rankings and Roadmaps project out of University of Wisconsin. Carson City ranked 13th on outcomes. I'm going to provide a little bit of deeper data on some of those outcomes measures, but kind of the takeaway is this is not that surprising considering where Carson City's ranked in terms of outcomes over the past couple of years. There was a drop there, and I've kind of highlighted counties that have dropped in rankings in red and those that have improved their rankings in green. But what you'll see, particularly in the next slide, please, is a lot of stability in these measures. For example, Carson City improved by a rank, if you will, we're on health factors compared to 2020. But again, what you see really on this is a lot of stability, not a lot of change among counties in Nevada on these rankings. Next slide. As I suggested earlier, there's a correspondence between, again, those health factors which shape health outcomes, and these two maps provide a very high-level overview of that. You can't really see Carson City that well in this, but kind of the takeaway I'd like you to be thinking about is, again, that correspondence between the two maps, with the darker shaded counties, particularly Nye, Mineral, Lyon, Esmeralda, regardless of factors and outcomes. Again, a close correspondence there. The darker the shade, the poorer the ranking. The lighter the shade, the higher the ranking. Next slide, please. This is a lot of information here, but I earlier pointed out that Carson City had a ranking of 13 on health outcomes, and that is a factor of measures of length of life and quality of life on the outcome, and so that you have kind of a sub-ranking of 12 on quality, 13 on length of life, which is producing that overall ranking of 13 on health outcomes. Similarly, when you look at your ranking of 7 on health factors, it's a function of a number of measures of health behaviors, clinical care, social and economic determinants, as well as physical environment. One of the things I'd like for you to, I always point out in these is your poor ranking, or middle of the pack ranking, if you will, on health factors is not a function of clinical care. I'll highlight that in a moment, but Carson City actually fares well on most of the clinical care measures. It's really those upstream social and economic determinants, as we'll see, which are resulting in that overall ranking of 7. So let's get into some of the detail on that. Next slide, please. Here is one measure of health outcomes, premature death. And these slides are going to look similar as I go through these. And from left to right in alphabetical order are Nevada's counties. Urban counties are highlighted with the dark green and dark blue bars. And here what you get is a glimpse of a couple of things. One, Carson City is about the middle of the pack when it comes to potential years of life lost before the age of 75. And this is a measure, again, of kind of an all things being equal, how much life is lost in a community prematurely, that is before the age of 75, due to factors that in principle can be prevented. And this will give you kind of a snapshot. I would say Carson City is about the middle among overall counties, but substantially higher than the other urban counties of Clark and Washoe. Next slide. One of the key components.
I'd like to interrupt
yes.
just for a second and
Please.
point out to people that I like to look at these numbers. You know, when you have it highlighted dark like that for the urban areas, it looks like we're getting compared to Clark in part, you know. And I like to compare us to Douglas and to Washoe. We're sort of like a contiguous area, and sitting right between Douglas, which on a number of these measures looks a little bit better, and Washoe, which on a number of the measures is also better. It seems like we should be able to at least come up to our local area. So really look at how we compare to the Douglas and Washoe. Thank you.
Yeah, and I would agree. And I would even take that a step further. One of the great things about the database, which I'll mention in my last slide, and how to access that database, it allows you to make any kind of comparisons you want. And here I've done this statewide, but Dr. Lyons, you're absolutely correct. I would encourage you to use that data information. You don't need to collect additional data. It's there for the taking, but again, it allows you to do some of those peer comparisons as you've suggested. This particular slide is another indicator that's key in the outcomes bucket of measures, and this is a percent of births in your county over a period of time that are low birth weight. And again, this kind of falls in that category of something that we know we can prevent most of these low birth weight births. There's a clinical component, there's a social services component, and so forth. I would argue that there's an insurance coverage component to this. But again, it will give you kind of a flavor of where Carson stands on that ranking. Next slide, please.
I'll just add one point here, low birth weight. It's not just the birth of the baby. If you have a low birth weight baby, you're likely going to have ongoing problems as well. So we're talking about schooling issues and those type of things. So you don't want to have low birth weight babies because the issues and complications and associated problems go on and can go on and can go on. So if you can prevent this from the start, you're way, way ahead. We know that every dollar spent in prenatal care saves at least 3, and that's old data. It's probably even more.
Yeah.
And what is
And I think,
2,500 grams? It says for low birth weight, it's under 2,500 grams. What is that in weight? Is that like under 3 pounds? What's considered low birth weight?
Help me out, Dr. Lyons.
Okay, I was just trying to get an idea. What does that mean?
Roughly, it's about 6 pounds.
Under 6 pounds is considered low birth weight?
Yeah.
Well, that would have been me.
Yeah. Well, look what happened.
I'm only a 5-pounder. Turned out. That's why I was really interested. What's considered
average
low
birth weight you'd like to see between, like, say, 7 and 7.5. But this is, I mean, I can calculate it. You just have to take that.
Thank you. I just think, again, to help the public understand, I don't think they know what 2,500 grams is. We all see birth announcements are 5 pounds, 3 ounces. What are we looking at?
Yeah, this is 5.5 pounds.
5.5?
Yeah,
Oh, I
under
definitely-
5.5 pounds.
Okay.
And that's small.
It was 5 pounds, 2 ounces. Okay, thank you.
All right. The final slide that I want to show in the health outcomes category is life expectancy. And these are estimates pulled together every year by the CDC. I would want to point out, though, this slide and most of the data in this presentation is all pre-pandemic. It will be very interesting to look at this over the next couple of years to see what the overall impact of the pandemic is, because what the preliminary data is showing, and I consider it very disturbing, is an actual decline in life expectancy across the country, across all racial and ethnic groups. It's not confined to one group versus another, but it'll be interesting to see how that shakes out. But what this data provides is information on life expectancy, and that is how long one can expect to live if you were born in, I believe, 2018 for this particular slide. And for Carson City, it's 75. And just as Dr. Lyons suggested, your sister counties or adjacent counties, living in Douglas confers a life expectancy advantage of 5 years in this case. And so it's kind of important to just note that it's kind of a truism in public health that your zip code is more important than your genetic code. And I think it's borne out by some of this life expectancy data. I think one of the most striking things is to kind of look at just the spread, and that is 10 years from the lowest ranked county, which is Mineral, to the highest ranked county, which is Lincoln County in southeastern Nevada. Now I want to turn to some of the health factors slides, and I'll try to go through these pretty quickly, but point out that every slide that I'm going to share with you going forward on these health factors, in principle, are ones that you as a Board of Health and Carson City as a community can address through a variety of science-based and evidence-based practices. This shows adult smoking and where you land among counties, relatively high among urban counties in Nevada, but better than most, if not all, of your rural peers. And I think it's kind of a sobering stat here that as much progress as Carson City and the rest of the state have made in curbing youth and adult smoking, it's still the case that 1 in 5 adults in your community currently smoke. Next slide. This is additional information on adult obesity, and this is a self-reported body mass index, which is a function of height and weight. Not so complicated measure, but one that the CDC has been tracking for a couple of decades. The bad news is that obesity rates are rising in almost every community that are tracked. So even though there's variation among counties in Nevada from about 24% to 40% of the population being obese, Carson City fares relatively well among Nevada counties. But again, every single one of those counties, we've seen a slow increase in adult obesity. Next slide. Here's some good news, and that is a set of slides on clinical care access. This one tracking the percentage of population under age 65 without insurance, relatively high for Carson City on this measure. Again, this is one we're going to be paying a lot of attention to over the next couple of years, because the pandemic in disrupting employment in the state has also disrupted employment-based insurance coverage. And so we'll see how that shakes out. At the federal level, there's been measures to mitigate that through subsidies on the private insurance exchange, as well as safeguards for the Medicaid population. So we'll be keeping an eye on this. The next couple of slides, though, you'll see that Carson City fares relatively well, not just among urban counties, but among all counties in the state. You guys do well in terms of the ratio of population to primary care physicians. Just compare, for example, Carson City versus, say, Pershing County, whereas Carson has roughly 1,300 residents for every primary care doc. The opposite is the case, over 6,000 residents for every primary care doc in Pershing County. Next slide. Similar story with Dennis, good ranking here. Next slide. This one looks at the population ratio of mental health providers. This includes psychiatrists, psychologists, marriage and family therapists, as well as clinical social workers. And again, Carson City does well. Now, it could be the case that some of these good provider metrics need to be put in context if you have above average health and public health needs. But again, at least on the provider side, Carson City fares quite favorably, actually.
May I ask a question
Next
on
slide.
that? May
Yes,
I ask
please.
a question?
Yeah, of course.
That this particular factor, and even the physician and dentist, it does not account for if I'm a Carson City resident. And so like our medical group, Carson Medical Group, many of the doctors moved to Minden on Ironwood, which is where my doctor moved. So I followed my doctor. So this then, that doctor now will count in Douglas County instead of Carson City. So it doesn't mean that Carson City residents don't have a potential primary physician within the area. It just means it's just Carson City only, correct? Not where the patient
Right.
resides from. Okay, I just want to put it again on the record. It doesn't mean some of our residents don't have access to a primary care doctor, because my husband uses a doctor in Reno. I use the doctor on Ironwood. So, okay, thank you.
Yeah, and I would also point out that, and again, at the risk of stating the obvious, if you go back to that dental slide, while you, by all appearances, have no, a nice, stable supply of dentists in your community, that doesn't necessarily mean your residents have insurance coverage or the ability to access those dentists. Right now, Congress in DC is wrestling with whether they're going to make dental coverage a part of kind of the standard Medicare benefit. And what that kind of points to is a lot of individuals over the age of 65 that have oral health needs, but no coverage. And so just having a dentist is no guarantee that people are accessing that or can afford that type of care. Next slide, let's go down to flu
And if I
vaccinations.
could add on the mental health providers, so this data is from 2018. And just recently, we are lucky to have 2 community certified behavioral health centers. And so we've got a pretty large outpatient through Vitality, and that has really increased these mental health providers. So yeah, these figures lag a little bit, but it is what it is. Just like we heard from the housing presentation at the Soups On. So just some things to think about.
And I would just add one point too. When you compare us to Washoe or even to ourselves, as the mayor has pointed out, patients travel, and Reno has a huge service area as being the major medical locale. So they're serving Northern California, and a lot of outlying areas are coming into Reno, and we get some of that as well. Some more of our rural would prefer many times to come to us versus going to Reno. So these numbers have to take in, you have to look at it as a larger geographic area. And I would say that there's a critical shortage of primary care in the United States. And thankfully, we have a medical school in Reno, and we also have a family practice residency in Reno, and that has definitely fed the local area, and very specifically Carson City, with new family physicians. So that's very important.
Yeah, and I would add that, at least on the primary care information that I shared with you, one of the things it doesn't take into account is a really nice, phenomenal growth in the number of nurse practitioners and physician assistants in Nevada. And I kind of shudder to think about what our primary care capacity in Nevada would look like if we didn't have those individuals, frankly, moving to Nevada to practice, particularly on the nurse practitioner side. And so there's kind of a good story that's not captured in some of that provider data there. Okay, let's go down to the flu vaccination slide. Again, pre-pandemic, but very revealing, I think, because what this measure is looking at is the percentage of Medicare enrollees that have had an annual flu vaccination, a little bit higher in urban counties versus rural, but Carson City's close to the top there. That's good. So I think we'd like to see that percentage much higher than 47%, 75% would be a nice target there. But I think this is actually somewhat predictive of what adult COVID-19 vaccinations have looked like across the state. Lower in rural counties, higher in more populated areas of the state, including Carson City. Next slide.
I'd point out on this that the Quad County, which is serviced by our public health preparedness team, is doing a great job in that if you also look at Lyon for the smaller counties, and if you look at Story, those numbers, you might not see them quite so high if it wasn't for the Quad County Coalition and their efforts and our work with our neighbors.
All right. Next metric that they track, a very important one actually, is the percent of adults over the age of 25 who have either a high school diploma or its equivalent, a GED, for example. Again, another one that I think all of the data is pointing to a little bit of a dip across the state in high school graduation, but this will give you a flavor of where Carson City ranks among Nevada counties. And 87% in the year that this was tabulated. Next slide. Child poverty is another thing tracked by this project. And the importance of this, I don't think can be overstated. If you think about adult health and the factors driving that, a lot of attention is paid to child poverty. And again, while Carson City is in the middle of the pack among Nevada counties here, I'm not sure if there's any good news in this slide. If the best Nevada can do is having 12% of poverty, but you get again kind of a flavor of the variation across counties with this. Carson City being slightly lower than the Nevada average, slightly higher than the U.S. average. Next slide. Closely related factor or determinant to child poverty is the number and percent of single-parent households. It's not the case that a single-parent household translates into childhood poverty or poor socioeconomic standing of a household, but it is a part of that. And the takeaway here is that one in four kids live in a household that's headed by a single parent. And gives you an idea of where you stand here. Relatively high among Nevada counties, urban and rural. Next slide. This is reported violent crimes that are been a part of the county health rankings metrics. Carson City fares relatively well here, regardless of what you see on the news on any given day. And the final slide. This is one that policymakers at all levels are paying a lot of attention to. And again, as your earlier discussion of tuberculosis suggested, poor or inadequate housing is tied to a number of health outcomes. And this is a graphic that I'm afraid to say, I suspect in the next couple of years, we will see these percentages inch up across the state, including Carson City rather. But here it is, reporting that roughly 1 in 5 households report some difficulty with either overcrowding, costs, or poor housing issues and problems. Now, the next slide, I could spend a day on this, but I'm going to make just a real quick observation. The Carson City data on this is looking back over the 11-year time span in which this type of data has been collected. I have no explanation for why Carson City experienced a rise in the mid part of the previous decade, but would really kind of point out to the stability of rankings, at least on mortality measures such as life expectancy and premature death, and how stable those have been over the past 6 years. Next slide. And similarly, I know this is looking at a lot of spaghetti, but it's kind of breaking down those components that create the overall health factors ranking. The dark blue bar throughout there, where you've hovered kind of between 8 and 11 over the past decade, and what comprises that. And again, I would point out that all things being equal, it's not a function of poor clinical care or access to providers, as the previous slides have suggested. It's really some of those social and economic determinants and some of the housing issues that were highlighted in the physical environment factors. So next slide. Actually, Nikki, forward to the next slide, please. Now, with all of that quick tour through the county rankings data and some of the individual measures, I want to kind of close by pointing out that an impetus of this project and why I think it's important for Nevada and for individual counties to take this periodic annual look at rankings is not the rankings so much, but what do we do about that? And I'm pleased to point out that one of the things the Robert Wood Johnson Foundation continues to do is underwrite the investigation of policy measures and strategies that communities can take to improve health. and I've listed some of those on the left side of the slide. I would just highlight a good example from Carson City, and that is a couple of years ago, I believe it was this board and Board of Supervisors that took some important steps for those complete street projects that you see, and that is making Carson City more walkable, making the environment conducive to getting out and running and taking advantage of a great climate for physical activity, at least outdoors and so forth. And so when we think about public health, let's be mindful of clinical and preventive measures that we can take, but also the whole host of social and economic and public policy and strategies that we can take to improve health. Next slide. Even better is what they call a curated strategy list from the Robert Wood Johnson Foundation. This is a dynamite website that I encourage the board and Carson City Health and Human Services to investigate. In each one of those columns there under health behaviors, clinical care, social and economic factors, and physical environment are dozens and dozens of evidence-based, science-informed measures that have worked in other counties to improve those health outcomes. And so I'm really bullish on the opportunity any Board of Health has in that you don't have to start from scratch. There is quite a long and growing list of measures that have worked in other communities, and I strongly encourage you to investigate those, and I'm happy to help you investigate those as you proceed with this effort. Next slide. This is a slide that I've included in presentations recently, particularly with everything going on with the pandemic. And it's to highlight that we think about public health. I think if there's a silver lining on the pandemic, it's that the public has a much better understanding, maybe not an appreciation, but a much better understanding of what public health is. And to try to kind of paraphrase Tip O'Neill saying that all politics is local, I would argue that all public health is local. And it starts with agencies such as Carson City Health and Human Services at the kind of the center of your local public health system, but it involves a lot of other agencies and actors within your communities, nursing homes, community health centers, policymakers, law enforcement, and so forth. And so for good or worse, your local health agency gets more than its share of the brunt of criticism, particularly when we're in the middle of a pandemic. But I would argue that public health and measures to improve health in Carson City are everyone's responsibilities. The role of your local health department, though, is to convene and facilitate and perform certain public health functions, but it's everyone's responsibility. Final slide, I promise. This last slide provides a link to the county health rankings and roadmaps. Every morsel of data I've shared with you in the previous slides, as well as, again, that curated list of policy measures and strategies you can find on this website. It's a dynamite website. They update it, I would say, on a weekly basis, adding those measures and strategies and so forth, as well as the data that you can find right now on your community. With that, I'm happy to take any questions.
I would just add a comment regarding the child poverty that federally it's been reported that we have a 50% decrease in child poverty secondary to the child tax credit. So hopefully that in of itself is being very helpful. And at the beginning of the report, I think that there's the opportunity with the low birth weights and smoking I think those are some big opportunities potentially for us, so just would point that out.
Yeah.
I also, on the local public health system, and, just to really point out how many agencies and how interactive it really is, and the role of NGOs or our nonprofits, and just the critical link and the amounts of services that nonprofits provide to help public health be successful, and the role of public health to help, the NGOs be successful. So thank you for including that. I also, and when I called Nikki the other day and pointed this out on page 602 of the packet, or page 6 of the rankings, that growing healthy places means ensuring opportunities for all. And I just want to read this on the record. Access to secure and affordable housing, safe neighborhoods, good paying jobs, and quality early childhood education are examples of important factors that can put people on a path to a healthier life. But access to these opportunities often look different based on where you live, color of your skin, or the circumstances you were born into. And I think those circumstances you were born into, that it plays such a critical role. And so I so appreciate this report, because I think it really highlights the need to be mindful of that big picture, or the underlying layers of what leads to some of these problems. So thank you for your report. It was really, really powerful, and I just got so much out of it.
Thank you.
If there was one thing, if you looked at all of the what works for health and some of the criteria or best practices there, is there an actual practice that you think Carson City should implement that would just be? Not turning it on and off. Okay. Is there any one policy that you think could impact these outcomes that Carson City could implement?
That is a great, tough question.
I think it is for us too, but I think that's the heart of what we're trying to discuss is, great, we see all these rankings, but everything about today is about you're looking for us to make some decisions and to say, oh, we're going to start putting things in policies, but nothing's concrete. And for me, I prefer that you say, okay, here is whatever, a tobacco policy, right? Because I think I heard that earlier. Or here, actually, let's go with low birth weight. What can we do as a county board of health? And so I would much prefer to see a few distinct policies that we could start to sink our teeth into to start impacting these outcomes. And so is there something that, as an expert, you've been looking at all these across I guess, at lots of places, but what's something we could work on that you would recommend? Like, where is it?
Happy to give you a couple of examples. And so in addressing those smoking statistics right there, there's a number of measures actually that can kind of only be done at the state levels. For example, the tax that you put on a pack of cigarettes and so forth, but there's a lot you can do locally. And I would encourage you, yes, focus on adult smoking cessation, but do everything within your power to keep young people from taking up smoking. That can range from enforcement of retail sales of tobacco, enforcement of Tobacco 21, which our legislature recently passed, but also thinking about what can be done in clinical settings, in non-government organization settings, to work with local public health and clinical providers to address cessation. I have a younger sister who died of lung cancer, and it was a product of her starting to smoke when she was 18 years old. We can do better than that. And if you
Concentrate on the youth.
Uptake of smoking, you will move those adult measures. And again, within that county rankings curated list of strategies, you will find dozens of measures. And I think it's good because all the rankings in their totality can be overwhelming. And I would encourage you to focus on a couple of those areas, like smoking.
Thank you.
And if I could just add to that, for the record, Nikki Aker. So now with smoking, we also have vaping. And we've talked a lot about vaping and the youth. And we've got
And more vape than ever smoked, right?
Mhm.
I mean it.
And
Worse.
but now we've got a program that's pretty aggressive about youth vaping, teaching youth that, this is not good for you. There's a lot of bad products within the vaping. But I also, now there's a state, all the health departments, the Nevada Tobacco Prevention Coalition, they're collaborating very well and getting campaigns out statewide, which will help with that. And you'll see in my report, I've included some of that. So yeah, it's an initiative that we're working on. We're encouraging others to work on, like the schools. There's talks with the schools about how do you prevent youth from vaping in school, because it's happening. So, and then I'm also happy to report that we've been working on multi-unit housing for a long time, because individuals that smoke within those, within their apartment, then others are exposed to secondhand smoke. And we right now are working with Carson Hills, which is the big facility behind Fandango. They are interested in a smoking policy, a no smoking policy within the apartments. So that's an exciting project. And they are also the managers of that apartment complex, has apartment complexes in Reno as well. So they'll first work on our complex, and then we'll turn it over to Washoe County, and Washoe County can work with them up in Reno. So,
Wow.
and on our website, we do have listed which multi-housing units do have a no smoking policy.
Thank you.
Yes,
I have
Supervisor
a
Jones.
question.
Oh,
If we
excuse
can
me.
go to page 604 on the measures in national state results, that would be page 8 of the Nevada report. Clear down at the very bottom, in the physical environment part, it lists driving alone to work as a health factor. Can you tell me how does driving to work alone become a health factor?
Well, the quick answer is that kind of the idea or thought there is the relationship between social isolation and health outcomes. And so I would point out, though, that each one of those measures that factors into the rankings is weighted. Smoking and adult obesity, for example, are heavily weighted. That's a minor or sub-measure there. But again, the idea is communities like Carson City are somewhat unique. You have a lot of people that one individual in one car spends 2 hours back and forth driving to work. And again, I would highlight that it's not a critically high or important factor, but it is one of close to 40 measures that find their way into the rankings.
Thank you.
But I'd also point out that if you dig deeper, all of these measures are going to have some scientific backing, right? In terms of they're not just picked willy-nilly, oh, this must be something that factors in. These are shown to be of import. Now, that particular measure, I would imagine, is of more import in urban areas than it would be in rural areas. But driving to work, if you fall asleep at the wheel, which turns out to be most common in the morning, one would think it would be in the evening, but it's actually most common in the morning. That particular one may be more relative to urban. So you'd have to dig into that county health rankings and the Wisconsin data to find out the scientific basis. And
Thank you. I would like to take you back to page 602, the paragraph that Supervisor Schutte pointed out. The last sentence in that paragraph says, pattern differences in a range of health factors emerge from unfair policies and practices at many levels over many decades. I'm just curious, what unfair policies are we talking about?
those could be things like zoning, housing zoning, redlining, that type of thing. Policies that have been in place, policies not to loan to certain ethnic groups, that kind of thing. So affecting someone's economic opportunities, policies that do that.
And those are profound.
And those have been over decades, yes.
Thank you.
I have a question. What are our policies on selling of cigarettes? Are we enforcing sales of cigarettes under 21?
So that, yes, we're doing education to the merchants in the process of doing that. But that also is through the AG's office, that they go and they do spot checks.
So I just have a question on that, though. The sheriff's office does the alcohol shopping, and it's just a question, could they try to buy the cigarettes at the same time? You know, because that, I don't know, I'm not going to say it always goes together, but I just wonder if we don't send you separate out to go shopping to see if they're violating for
We don't do
smoking, but
that,
could we combine it?
We don't do that. We don't combine those operations. The Attorney General's office runs this anti-smoking.
But can we?
I see people buying cigarettes all the time that aren't 21.
Right.
Everywhere.
Yep.
I don't think there's any enforcement at all.
Agreed.
And I don't think the general public even has a knowledge of this law.
I think the Attorney General's office is, but I don't think it's very well publicized, and
I don't either.
I don't know of the frequency.
Well, I would just point out that this law just passed the legislature, and that would be one of the things that we might want to take on, is to just get the information out there, that this is the law now. And it is now the national. I think every state in the union now has Tobacco 21. So.
And for the record, Nikki, so that merchant education is part of getting that information out to the merchants, and our tobacco prevention staff are working on that. We were very appreciative that we had one of our tobacco prevention staff that participated with Partnership Carson City, and when they did their alcohol training. So at the last training, we had one of our staff there to talk about the cigarettes. And upcoming, we're going to do what's called a STARS survey, and we will be hiring temporary staff to go and survey the different establishments and find out where are the tobacco products located. It's quite an extensive survey, and it's been done before. And this is all also tied to tobacco funding for Nevada. So there are efforts being done in these different
Well, I
areas.
agree with Supervisor Jones, though, and maybe again, it fits. It's like, if you don't have any enforcement, you're not going to have success in making a true difference in this particular outcome or indicator. And so I'm just trying to find, is there an effective and efficient methodology that we could piggyback onto that wouldn't be great, right? Because you got Partnership Carson City that's working on the training for alcohol. Why can't we add smoking to that? I don't see any issue of adding into the curriculum a 10 or 15-minute thing that, guess what? That carding you're doing for alcohol is exactly the same answer for cigarettes,
Correct.
right? So it should be treated identical. When they come up to the counter to buy cigarettes, you should be doing exactly what you're doing with liquor. I don't think it's a big stretch, and I don't think it costs a lot. I think it's one we could hit without spending a whole bunch of money. We could fund our own additional ones if we just wanted to do cigarettes, but I'm just trying to find a health outcome or something that we can work on that doesn't cost us.
Well, I think a big part of this, though, in addition, right now we're talking about the what? We're talking about enforcement, but then going back to the why, and why are kids wanting to smoke, or why are kids wanting to drink, or why are kids using? Part of that is because they enjoy it. They enjoy it. And they see that not everyone, let's say, who smokes dies of lung cancer, or it's so far in the future that, they can't imagine being 30, let alone 50. And so to that, in addition to enforcement, because some of them might have somebody else buy for them, so they're not going to worry about it. But it costs them money. Kids can all relate to money, and money is something in the here and now. So any of these things, even, whether it's drug use or other risky activities, this information is good because it can give tools to what can really make an impact in the lesson. When I was teaching health, it's all fine and good to talk again about the risks, but for that frontal lobe brain, for kids, they think fun factor. That's what allows kids to dream. That's what allows kids to eventually move out of the house because they want to meet, they want to go conquer the world. Adult brains, our frontal lobe, it's risk factor. So we think in terms of risk. We think in terms of planning and the cause and effect. That's not part of the frontal lobe. So this info really helps establish good policy for how to meet kids where kids are. And so I think that's the part that in all of these presentations, we need to be really mindful of. You can have all kinds of great info, but if kids don't relate, or if they think, well, that's going to happen to someone else, then they're going to not really, it's not going to be applicable to them.
I would just want to add that we will be doing another community needs assessment, which is very collaborative with the larger community. And I don't think that there's any one thing that the board can decide to do on its own. It really has to come to from the community, and it has to be a community effort about what is it we want to take on as a community. Do we want to take on low birth weight babies, knowing the consequences to us as taxpayers, in our schools and blah, 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 in our criminal justice system, et cetera, et cetera? Or do we want to take on smoking and vaping and, the hookah lounges and, what do we want to take on? But whatever we want to take on, it's not just the Board of Health, it's not just the Board of Supervisors, it's not just the sheriff and doing some enforcement of some law. It's rather, what do we want in our community to say, we got a hold of this. We're going to take a hold of this. We can make it better. We can make it better here.
And why is it important? And why
It's important. That has to come from the community. If we don't have community buy-in, then, you're not going to get very far. So we will be doing that. And we do have a policy that we want to address today that we brought to the board, and we'd like to have the board consider that. and that is health in all policies, and so that's part of the next agenda item. Any other comments?
I'll just make a final comment on this. This is Nikki. So as attachments, you have the 2020 report, and the late attachment was a 2021. So all this information is in there. The website, there's a lot of information, and I encourage the community to look at that as well. John, thank you very much. I appreciate you so much giving us your time on your vacation.
Yes, thank you.
Yes, thank you very much.
Thank you.
Happy to join you. Happy to join you. Thank you.
Been great.
So that was for discussion, great discussion. Thanks, everyone, for your participation. And now for item 22C, discussion only. This is a presentation by Sydney Gamer, who is a public health, master's in public health candidate, and she's going to present this concept of health in all policies.
So Sydney is making her way up here. She approached me to see if I would work on if I knew of any projects that she could work on with me. And I was so excited because I've been wanting to work on health in all policies for some time. It's a concept that's not new. It's been around a long time. And so I tasked her with that. And so I'm going to let her tell you what she has done with this and what she's learned.
Okay, can everyone hear me? Cool. Like they said, I am Sydney Gamer. I'm a Master's of Public Health candidate through the University of Nevada, Reno. My focus there is public health administration and policy. And as part of that requirement for my master's, I have to do 150 credit hours for my internship class. So my internship, like Nikki said, was under her direction and her mentorship about health in all policies and how Carson City can utilize this tool moving forward. So really, what is health in all policies? A simple definition is health in all policies is a tool that allows pretty much any policy that you can think of to become a health policy with the right lens. And using a lens is putting on, those health-focused glasses and trying to see how can this down the road somewhere affect a person's health, whether it's individually or through the community as a whole. And it's extremely important because it can increase favorable health outcomes, which Dr. Peckham just gave a great speech about. It can decrease health disparities in our communities, and it can also help engage diverse stakeholders and come to lead creative ways to solve multiple problems at one time. So my internship progression was really 3 different phases. I started off doing research about best policies or best practices for health in all policies, trying to see how other communities are utilizing this tool, ways that they've engaged their communities and different stakeholders. And I also did some research into Carson City's county health rankings and seeing where we moved and how we ranked among other counties in Nevada. The next part was holding 2 different focus groups. My first focus group was held at the Carson City Health and Human Services Division Managers meeting. I also had Nikki there with me and Dr. Lyons who participated. The second focus group was held with representatives from Carson City government agencies. And that was a few different people from different sectors of government throughout Carson City, which is a big part of health in all policies, is that collaboration between different sectors and not just focused on health, how the local health authority can impact health. And the last part is kind of what I'm doing today, so this presentation to you all. And I also came up with an implications and suggestions page of how we can use health in all policies to improve our county health rankings specifically and the health of our community and residents in Carson City. So my research findings. Engaging with the community when you're working with them is extremely necessary for successful results to be implemented because the community, as Dr. Lyons talked about before, buying in is crucial to them wanting to take on or listen to any policy that you set forth at a local government stage. It's also imperative to create task force and coalitions dedicated to health and all policies, to lead efficient results and integration into policy. I know Mayor Bagwell talked about what is a policy that we can implement today, what is something that we can do. And those task force and those coalitions dedicated to that can come up with those ideas and those policies to set forth for the community and give you those real tangible results that you can look at and you can touch and you can read and you can give to the community. And next, utilizing the knowledge of different government agencies along with private businesses create space for stakeholders to see their community's needs get met. And that kind of ties into engaging with the community that you're working with. You really want to get as much knowledge from as many people as you possibly can to impact health and to create a space where everyone can feel that their community's needs are getting met, because different people from different factions of government have different ideas of what is most important to their community and what needs to be changed first and foremost. So some potential barriers that we did discuss. The first one was really interesting to me. I'm new to the world of grants and how they work. So it was a point that was brought up in our first focus group meeting, was that grants and the way that they're written can be a little constrictive and can not allow so much cross collaboration that we would kind of like to see in health and all policies. So really looking at the scope of work and deliverables and see where intersection can occur with different grants and how people are working within them is a way that we can potentially overstep that barrier. Next is cultural values. And so when I thought of this, the first thing that I really thought of was that pandemic fatigue that we've all been feeling. We don't want health and all policies to be seen as something that's another mandate or a rule that we're pushing for everyone to follow, whether they like it or not. Health and all policies should be something that we work into what we're doing already with policy and legislation. And we want to convey it as something that it's going to be beneficial to everyone. It's not just a rule that you have to do. It's something that you should want to engage in with your community. And that what's in it for me factor as well. Private businesses may be hesitant to adopt health and all policy approaches without a proven economic benefit right off the bat. So it's definitely important to address that, I think, in those task force and coalitions, how we can have a healthy community be an economically successful community as well, because we know that healthy communities are usually more successful, and you find more economic benefit if a community is healthy and, you know, ready to work and able to get outside and engage with all the different things that they may have there. We also might see some additional burden placed on some departments and not others, especially within government agencies. As we've seen through COVID, everyone is short-staffed everywhere. So, you know, having this be another project or another thing to add to anyone's agenda could be seen as something that's difficult. Also, if I'm talking too fast, just let me know. I tend to do that. So our focus group dates and findings, like I said, our participants, at our first focus group was CCHHS Division Manager meeting, and then the second one was various Carson City Department representatives. And we did have some common thoughts about health and all policies that came out of both focus groups, and that was health and all policies can be adopted, but definitely in a phased approach. So not just throwing it right into the mix right off the bat, but kind of working it in maybe through the sections or the departments that it can most easily be seen in, so possibly something like Parks and Rec or infrastructure, and then working its way to other departments that may have to get a little bit more creative with developing health and all policies in their policies. And also engaging entities outside government will create a more successful program, so that ties back into really engaging our community and private businesses and maybe even school districts, nonprofits, all the different places that we work in now as a government agency. And marketing existing projects as health-related projects. Carson City has a lot of different ways that they're engaging people's health and really making improvements to it. Our Complete Streets program is a great example of how health and all policies should be marketed. It's not the health department that came up with with Complete Streets, but yet it is engaging for a more healthy community and getting people out there creating safer streets for people to drive on and to walk and bike on as well. So some ideas for Carson City is getting input from the community, whether we hold community focus groups or possibly even do survey findings. I know right now I work in public health preparedness doing the COVID vaccine outreach. So a great way I thought you could do it easily from community members that are using our services already is maybe handing out a little five question questionnaire at a community vaccine event. You know, what do people want to see? What do they think needs to be improved about their community's health? And right then and there, you're getting people's ideas, their feedback. And if they see that in policy, they know that they're being heard and they're being listened to by their government officials. Also emphasizing the long-term and short-term economic benefits. As I said before, we know that a healthy community is an economically successful community. So really emphasizing that to private businesses and seeing how they would like to engage their employees and how they could also engage the public as well. And for usability, this approach may be more user-friendly for other departments like Parks and Rec, Community Development, and Infrastructure. So just starting off there and seeing the benefits that they could kind of come up with and the ideas they have, and then maybe using it more and more down the line. And other agencies may need to get more creative to adopt health and all policies or to really put on that health-focused lens and see what kind of policies that they're used to working in and how it could boil down to health. So county health rankings and health and all policy. I thought that health and all policies would be a great way to affect our county health rankings and to improve them. We talked a lot about the social determinants of health and upstreaming, and health and all policies really focuses in on that and how we can, as a community, collaborate really to improve health outcomes. So one example is a poor health outcome would be poor physical health days. So that's days where you're spent at home, whether it's you're sick or you're injured. And then a health factor would be something like adult obesity, which we also talked about earlier. So a health and all policies intervention could be Parks and Rec, community development, and private businesses could work together to implement ways for community members to get more physical activity. Like I said before, the Complete Streets program is a great way to do something like this, where it engages people to get in, to go walk to work or bike to lunch or take their family out on the weekend. Things like park days, bike to work or school days, and then more information about where parks are located and where people can be physically active outside should get advertised throughout the community. Because again, it's not reinventing the wheel, it's really just pushing what we have already going for us here in Carson City. And then we could also engage with local businesses and gyms to offer employee deals. Maybe they get a kickback or they get like $10 off of a membership if they join a certain gym. So that's beneficial not only to gym owners, but to private businesses. They'll have healthier people, less likely to take poor physical health days if they're getting the exercise they need, and they can do it at a lower price too. So the importance of health and all policies. New partnerships with non-traditional partners outside of the public health and healthcare sectors is extremely beneficial and very important to the continuation of a healthy community in Carson City. Like we talked about before in Dr. Peckham's project, he was talking about how it can't just be the local health authority or public health that does everything. We know that. We know that we need the collaboration from as many different diverse stakeholders as possible. And we really want to affect the long-term health of Carson City. We want to create a safer, cleaner, healthier community that people want to come to live and to have families and to stay for long periods of time. We want tourists to come through because it's a beautiful part of Northern Nevada that should be showcased. And we want more policies that are created with a health lens. So we want to keep that resident retention there. And economic. We know health is wealth, and we want healthier communities that are good for business and the economy overall. So some suggestions about implementation. That collaboration is a big piece of it. We want to invite members of various government sectors along with representatives from private businesses and community members to be a part of a Carson City Health and All Policies Task Force. Health outcomes versus health factors. We want to use health and all policies to increase Carson City's county health rankings. And health outcomes like obesity are influenced by health factors such as socioeconomic status. Using health in all policies can decrease bad health outcomes by intervening with different health factors like infrastructure, access to healthcare, clean air, water, etc. And suggestions from the focus groups was phase in health in all policy approaches and really educate stakeholders and the public about what health in all policies is and really what it can do for them and what it can do for their community. And creating that task force and starting with looking at health in all policies could be applied, could lead later down the road to those tangible policies that get written and implemented into law. And really just policy, any health policy can be a health policy if you look at it hard enough. May take a couple minutes, but you can really get there, especially with a lot of the ones that we have to do that we look at today. And these are some of my references. There's a lot of great information in there about how other local health or local communities have used health in all policies to increase their health. So yeah, thank you so much for listening. And if you have any questions, let me know.
This was a wonderful report, and it was really thought-provoking. And so I appreciate, especially when you spoke about the potential barriers, because there's just so many layers to that. And then that the highlight of what's in it for me, because yes, again, people really need to see the relevance of how will this policy help me right now. So thank you on that. Also acknowledging the importance of being heard. We all come to where we are on the health spectrum because of different habits that we have or what we enjoy, what we don't enjoy. And so a health policy needs to be relevant to everyone. And finally, on the suggestions and implementation, when you spoke of being creative, and so as you were speaking in different ways to encourage movement, so thinking of, our museums and the state prison and touring our museums and seeing what's available. You're walking, you're talking, you're interacting with other folks. I was thinking about, volunteering at the animal shelter, walking dogs or interacting with animals, which has such a positive, healthy outcome. Volunteerism, whether it's helping, whatever, the Big Brothers, Big Sisters program, Boys and Girls Club. So ways to get up and out and physical, or even just standing, not sitting, all of it is a benefit. So thank you, and it was very thought-provoking.
Thank you.
I'd like to comment next. This health in all policy is a way for those who generate policies to be sure that they consider health when generating that policy. So we do a zoning policy. Like, one of the things that I've seen is these neighborhoods that I call them the California cookie cutter houses. The really big houses, tall houses on really small lots, and there's hardly any parking on the street, and sometimes there's not a sidewalk. Is that the kind of thing that promotes health? I don't know. You go in your house and you shut the door, and then you stay in there? It's not the kind of neighborhood I want to live in. And I live in a nice neighborhood with no sidewalks, really. I mean, plus minus sidewalks, actually. But it's a walkable neighborhood because the streets are wide enough to walk on. So to consider those kind of things, because those are mental health issues if you're always cloistered in your home. So to have that lens, you put on the lens, okay, this is a policy, we're making a policy about zoning laws or whatever, or housing laws. Are we going to have housing where you build big expensive apartments, but then, how do we get the funding or get that developer to do some affordable housing also? Is that automatically included in the policy? Because we know housing is a big issue for health, right? So we put on the one set of glasses, just our plain normal glasses. We're working in whatever department we are. And then we have to put on the glasses of how does this affect us? These are probably sunglasses, okay, dark. How does this affect us, economically, okay, in our community? Then we got to put on the glasses about, is this equitable for the members of our community? And we need to put on the glasses, and I like to say blue, I don't know why. The blue glasses to look at what is the health of this going to be. So health in all policies is an attitude that I would encourage the Board of Health to encourage the city of Carson City to adapt. That we're going to take those blue lenses out, no matter what the policy is, and see how is it going to affect health. And we know the FAST program, excellent. It gets the medical, it gets the mental health aspects, housing aspects, economic aspects, job aspects, all of that. That was a great health policy. Now, we may not have looked at it that way, but other things we do let's always remember to put on the blue glasses and take a look at whatever that policy is. So that's what adopting a health in all policies for Carson City would look like. And I would encourage the Board of Health to recommend that the city adopt that. Blue lenses.
So, let's see if I can say this right. I'm okay with something, I got a better way to say this. If I look at my agenda, we always have statements about what is the fiscal impact, what is this, what is that. I do not mind adding a health rationale, right? To, like you said, to have us focus. So I really appreciated where I cannot support just jumping in with all feet because we're not going to get community support. But I think if we could start with what you're all talking about and what I was hearing today, if we could add a line on our agenda items, that health rationale, so that we can begin to do just exactly what you're saying, all of us, right? Hey, whoa, we're going to do X, Y, we're getting ready to do Title 18. We'll start seeing different sections coming to us, right? If we could start just getting people to think of health, you are, I think, correct, right? Because then the community's going to see that's what we do. Every time we think about doing something, we have a health rationale. This complete street, we just adopt this policy, but we add a line in there that says, we hope this will improve health indicator, blank, blank, blank. Hope all of them. That one might be an all-inclusive, but I am okay with starting slow and getting all of us, that way all the departments, and sometimes they'll write not applicable. I mean, buying cars they're going to write not applicable, but when there's a policy that all departments then have to think, can I impact something? Is this going to help me with smoking or low birth weight? Or, is there anything in this county health ranking that I can impact with this thought? So I am okay with starting small, not having our businesses think we're going to start doing things to them. I'm excited. I'm going to be doing some health stuff and hopefully sharing some of this at the chamber with the businesses. I think that's another step that we as members of the Board of Health can be emissaries within the business environment, maybe to help start taking that fear factor out, right?
Yeah.
So that they do become our partners. And I also am willing to look at starting on your task force with the businesses. But what I wonder, do we have the wherewithal in place if I'm, Glen Eagles Restaurant, and I want you to help me figure out how I tell a pregnant woman that I'm not going to serve her alcohol? Is that the type of stuff we're talking about, right? She's pregnant, don't let her have a drink. are we ready to have tools to help her navigate that so she doesn't have a big scene in her bar? Does that make sense where I'm going? I'm thinking that's what we're all
Yes,
talking
I
about.
mean, I think if the community comes together, like one of the big things for that I would be excited about, and I mentioned this when we did my interview for this position, is that 1 in 3 Americans has issues with metabolic syndrome. Okay, this is a huge issue for hypertension, cholesterol, obesity, diabetes. Okay, all of these things wrapped together. And when you name all those things, you're talking about more than 1 in 3 people. So this could be a community campaign where the restaurants are involved, employers are involved, government is involved. I mean, because the things that make a difference are just being physically active, even if you don't lose weight, makes a huge difference. If you lose as little as 5 pounds, it makes a huge difference. People start to make sure that their blood pressure is controlled. Has it been checked? What is the target? You should get into your doctor, et cetera, et cetera, et cetera.
Right.
So, yes, I think it just literally needs to start with putting on the blue lenses and going, does this affect our community's health outcomes in a positive way or potentially negative? And even if it's, like obvious, okay, the complete streets, right? Having a sidewalk or having a bike path, that seems relatively obvious. But still, if you start to emphasize it, then people will come up with all kinds of interesting ways how that policy is both detrimental or not. So yeah, I think that would be
A good
excellent.
start.
Yeah,
Okay.
good start.
And for the record, Nikki Aker, and the mayor just mentioned about the presentation she's going to be doing for businesses through the Chamber of Commerce. And I would just put it out there, if Mary Jane and I worked on that presentation, and I will put it out there if anybody wants to do any health-related or highlight what's happening at the health
After my
department.
presentation.
Yeah.
Oh, I just-
We're always willing to help. So I just want to put it out there that if you need our help on a presentation, we are happy to do it.
And just to piggyback on what Mayor Bagwell said, and I love that idea. And I think really it's about normalizing looking at something through a health lens. And it doesn't, in my mind, doesn't really need to be super specific. Because sometimes then that can put on its own brake. But that general through a health lens. So, for example, the vehicle. So when you said that, it's like, well, how could I look at that through a health lens? Well, perhaps a more fuel efficient vehicle. And maybe that would work, and maybe it won't, because maybe the needs are very specific and it isn't fuel efficient. But to think about it, I think leads to better outcomes, because there would be other vehicles that, yes, this would make more sense, or an electric car, because of this new big grant coming and the charging stations. And so there's always a way to find that health benefit, and it takes that creativity, which you even mentioned in your report. I mean, some of the departments have to get more creative. But the words have to, maybe we could, it's like they get to, because it's really quite exciting. And when it's normalized, it's not so, it's just part of what you think about, the different elements to a decision.
Yeah, I think that's one of the most important parts about engaging the community too, is normalizing health and how we talk about it, because I think the pandemic really brought that to the forefront of everyone's mind. We should be talking more about our health in an overarching way, not so much just pushing one thing, but how can we improve our health in lots of different easy, free, or cheap ways, and we can really help facilitate that from a
I think
government
we
level.
frequently look at health in terms of healthcare.
Yes,
but
like clinical.
Healthcare technically is sick care sometimes, frequently.
Yeah.
Yeah.
Did health.
Yeah, just really preventing is a huge thing right now. And again, I think public health is at this kind of forefront right now, where we have a lot of attention and we have a lot of coverage about prevention. And that's that's how we get away from the sick care and how we stop being a sick society and we can actually become a very healthy society. And I think health and all policy is a great way to start and a great way to ease into that.
Yeah, and I would just add to that, so public health is really looking at upstream. You may have heard that before. It's public or prevention. It's looking upstream so that we don't have these poor outcomes at the end.
And just for clarity, because I do want to be clear, I have absolutely no issue, again, as I said, starting small and putting the health rationale on things. But I also want to be clear, there are competing interests, and I think that's why I'm cautious here, right? I don't want to jump in with all feet and say that Carson City isn't going to do any policy that's not, that I can't point to a positive impact with health. So we need to be very careful, because you're correct when you talk about zoning, but there's lots of issues in zoning. And so I'm not going to jump in with the feet and say we're doing every policy in Carson City is going to deal with a health indicator, and I'm not going to let any new developments come in without a sidewalk, or I'm not going to let anybody improve their home and add on a garage, and if you do, you got to put a sidewalk in. So I want to just be very cautious here that always it's on our mind, and if we can make good policies, and that's why I just want the public, in case we're not talking about changing all our zoning rules and everything that we're doing to say I'm going to make everything more expensive because I want to impact this health indicator, and at the same time that meant housing just got 20% more expensive and whacked out another health indicator. So I just want to be clear, it's looking at our policies for a health rationale whenever possible, right? Whenever we can do something impactful. And like you said, I like the putting on a lens.
Yes, I definitely
lens.
concur with what you're
Okay.
saying.
Perfect.
But it's not always going to be, you're saying health, it's not always, we're not trying to find a positive in every policy in terms of health, but we also want to look at the policies regarding the detriments, potential detriments.
Yes.
We just want to be aware of them.
Yes.
We just
Like I
want to
said,
consider it.
yes,
You
I
know,
have-
is this a risk? Is this a
Yes.
downside that we are
Yes.
going to take because it's outweighed by the other potential upside, right?
Right.
We just want to consider that because I love it, Sydney. Health is wealth. And what businesses need to know, which is, and I want to encourage everyone, again, I mentioned this at our last meeting, the 7 ways businesses can align with public health for bold action and intervention. I've given that report to the mayor to share at that chamber meeting, and that was a link at on our last board. So anyway, that businesses are paying this price whether they realize it or not. Okay, they're paying it in, do they have productive employees when those employees are at work? Are those employees at work? How much is their health insurance costing for them to provide for their employees, et cetera? So businesses pay for this whether they're aware of it or not. And certainly, you know, we've seen that with the pandemic. By the way, thank God we had complete streets. One of the things that I noticed when we were totally shut down at the early beginning is that people suddenly found our parks and our sidewalks and our pathways, and they were out and about. I had never seen so many families out and about, walking, biking, that kind of thing. It was great. That was at least one positive. Thank you.
Thank you again.
Can I entertain a motion to take this forward as a lens that,
So we're on item 22D. I'd be happy to make a motion. I move to approve the use of the strategy as discussed on the record today on item 22C.
I second.
all those in favor?
Aye.
Aye.
Any opposed? Great, thank you. Moving on to item 22E for possible action, and this is the director's report from the Carson City Department of Health and Human Services.
There was one before that.
I'm sorry, what?
Yeah.
Um,
D, is it D?
But that's
that-
what we just did.
I did
We-
it. And
we
I
just-
referenced 22C as the presentation.
Okay, so I don't need to go through any of
Because
this.
that's where the record, yeah, anyway.
Sorry.
Gotcha,
I linked those together.
gotcha.
Okay. And so then on to your presentation.
Okay, I just want to start with, thank you for all this great discussion. I actually, I'm very happy with what passed. I was thinking it was going to be less than that, so this is a huge step for me, and I just want to thank all of you. So as for my report, I want to put a thank you out there to FEMA. They're going to be leaving us, and we will be coming on the 16th to, I'll probably do it during public comment, but to thank them, and we will have them here with us. These people have assisted us with many events. They've helped us with data entry. They're helping us work on a quality assurance project to make sure that all the information that's put into WebIZ is correct. As far as I know, we're the only agency that is doing that. It's so important to have this information correct. And so at the next meeting, just help me give a big thank you to them. Okay, my COVID update. I'm going to go really pretty quick on this, but looking at November 14th to the 27th, there were 186 confirmed cases. That was 30% of all Quad County, but it was a 15% decrease. There were, based on the average, there were 13 new cases each day, and again, that was a decrease. Through the Carson City schools, we had 17 case investigations of students, and 71% attended school while infectious. The Carson City exposure, 57% were exposed in the community, and 19% were exposed to someone in their household that had tested positive. For vaccinations, right now, Carson City, or as of November 23rd, Carson City was 53% fully vaccinated. And that fully vaccinated means 2 vaccinations for Pfizer and Moderna and 1 for Janssen. As of right now, we're not including the boosters. Breakthrough cases. 44% of the total known breakthrough cases since February 1st, Carson City represents that, is 44%. The overall vaccinated case rate for ages 12 and older is 18 per 1,000 population. And then for the ages 12, wait a minute.
That doesn't work.
Compared to the overall unvaccinated case rate, so I'm comparing those vaccinated, those unvaccinated, it is 157 per 1,000. We are still seeing vaccinated individuals are there's very few that are getting hospitalized or dying. A lot of our deaths are those that are unvaccinated. And so we do have, I'm sure you all have heard about the monoclonal antibodies treatment. And we'll have another presentation on that later. But I just wanted to give you all and the community some of the criteria that is out there for this treatment. Individuals need to be 12 years or older. Needs to be within the first 10 days of symptoms. Need to have a positive COVID test. Need to be immunocompromised and must weigh over 88 pounds. We do have this available in our community, around our community, and so you need to see a doctor to get this treatment at this point. And I'd also...
Nikki, I just want to point out that the monoclonal antibody treatment is very important for those individuals who are unvaccinated, who have any pre-existing conditions that are going to make them susceptible. The earlier it's given, the better, and it can be given sub-Q. I just saw on Newsfeed today that the federal, the government, Biden administration, whatever, is going to be supporting mobile, like urgent task force, get it out there in those communities that have a sudden spike, especially if they have a low incidence of vaccination, to be able to provide this, because it can be given just as a shot in the arm subcutaneously and has been shown to make a difference. We had quite a bit of this given out in Lyon County at one of the nursing homes because they had an outbreak, and they gave all their residents this treatment very successfully. No complications and from the treatment, and no complications from the COVID. So that's
And I'll
it's out there.
just put it out there, maybe for clarification. It's not only for those that are unvaccinated. It's individuals can get it if they're vaccinated as well. And I want to also tell the community that there are tests out there that you can get from a local drugstore. They're on Amazon. It will test, it's a rapid test if you have COVID at the moment. I would caution on this that it cannot be used for travel. If you're traveling, you do need to follow the rules of, like, if you're going on a cruise, you need to follow the rules from the cruise ship. And if your employer is requesting it, it may not be legitimate for that either. But there are those rapid tests that can be used.
We talked yesterday, Nikki. You don't think you have a need to be able to do rapid testing within your department with this increase, this new variant coming out and everything?
Not at this point. We have done rapid testing in the past, but it was only for like first responders and that. With the availability of this test that's out there, then if somebody has a rapid test and needs to get further testing, we have found that there are enough providers in the community that can do that. We, as of the 29th of November, did stop our community testing events, and that was because we were having maybe 7 people show up, and that is a lot of resources out there for a very low number. Because that also involves, it's not only the testing, but it also involves getting the samples up to the lab. So it's resource intensive, so.
Nikki, do you think it's because the reason you only have such a low numbers of doing that anymore is because we now have so much more testing in the community itself? I think in the very beginning, we really were the testing provider. And so it's not that we still don't have that much testing occurring. It's just now being done in doctors' offices and clinics. And we've been able, or our providers have been able to now step up to the plate
Yes,
and
that's
help fill that role, so they don't have to wait in cars for hours to get their turn in line. I mean, it's turned out
That's
a.
correct,
Okay,
because if
so
you
it's still
look,
available.
if you look at the State of Nevada website, you'll see that our testing numbers are still adequate.
Right.
So yes, we do have adequate.
Just want to make sure we're not
resources.
taking away a resource, right?
And if something were to happen and testing need would increase, then we're prepared to put that back in motion.
Thank you.
So, as far as vaccinations, we continue to do our outreach clinics in the Quad Counties. We are doing vaccinations at the clinic in Carson City on Long Street. We do them on Mondays and Thursdays, and appointments are requested. So if someone comes in as a drop-in, it could mean a long wait. So we are definitely requesting appointments. In the clinic, it's a little bit more difficult doing the vaccinations because there's a lot of different preparations. And on our outreach events, we can have a line just for Pfizer. We can have a line just for Moderna. And within our clinic, it just depends on who shows up. And again, we have other providers within the community that are providing this service as well.
Nikki, is your clinic also giving boosters, or is this for the
Yes,
the
we're giving
Great.
boosters as well. And we are in the outreach events as well. Okay, we had a lot of discussion this morning about tobacco control and prevention. We're collaborating with the other health departments on a number of media campaigns and efforts. The staff had presented to youth at Pawalou Middle School and Virginia City Middle School. We're trying to get into other schools to present to the youth about really what we're touching on is the vaping. And we are continuing to assist with the Attracting Addiction website, and this targets the vape flavoring. I've included that website on here. We have Facebook posts that are going out, and so I encourage you to like us on Facebook, and you'll see those posts going out about the different flavorings and the harm in them. So yesterday was December 1st, World AIDS Day. And World AIDS Day is always on December 1st, and this is to make people aware that we still have HIV and AIDS and still trying to work on decreasing that. And this was a project that Francis Ashley and our department wanted to take on, was having an art exhibit. So the state, they endorsed it. They sent out a call for artists. And this is what's presented on our wall over at the health department. We have had one art piece come from India, and we've had one come from the Philippines. So I encourage you and the public to come. This is in our lobby. Anybody can come when we're open and view the different art pieces and the stories that go along with it. And this is going to start being an annual event.
Nice.
Within Human Services, I wanted to congratulate Faith Barber. She is certified now as a lead trainer on the University of Cincinnati's Ohio Risk Assessment System. So this is a evidence-based risk assessment for individuals, which then we can help them with needs. So she's going to be that lead trainer, the only one that is going to be active right now in northern Nevada. So very excited about this.
This is
Just- yeah, put that on
for
the
those who are in the criminal justice system. This is, what we can do to help, what makes a difference, that kind of thing. So it's not for your average client, but
Just want to, we should just give a big shout out and thank Faith for taking this on and successfully doing that. I understand it's quite an accomplishment. So
It
if
is.
you're listening, way to go, Faith.
Yeah. I don't think she's listening. She
Oh,
was
well.
pretty busy today.
It was important that we recognize that. I
Yeah.
know it's another undertaking. I know it's a coursework and things that you do in your busy life, but anyway, just please thank her.
Also within human services, I've listed out here just the different assistance that we've given to individuals. We do work really hard to get individuals housed. We had quite a conversation yesterday in a task force meeting about housing that we're really low on inventory. But we have really worked hard to have those relationships with the landlords, and that has allowed us to place individuals within an apartment. So just wanted to highlight that. Also, Human Services is actively helping our individuals with COVID. So how this process happens is we have our investigators that call the individuals with COVID. And if there are any wraparound services that they need, like food, the prescriptions picked up, maybe they need some housing assistance, then Human Services case managers will assist them. So they had 12 requests since the last report. And we have also helped 3 residents be housed while they're in isolation and quarantine. Public health reaccreditation efforts update. So our documentation was submitted to FAB. So it's there. Now what will happen is FAB will review the documentation and then they'll ask for clarification, or we may need to submit other documentation. We will have our virtual site visit. It's probably going to be towards the beginning of next year, and then they make a decision on reaccreditation or action plan. And this is a process that we have to go through every 5 years. So public health emergency preparation. So even though public health preparedness is working on the COVID response, they are still doing emergency preparation. Since the last report, we've had a staff member that completed liaison officer and finance administration unit leader trainings. This becomes very important as we request reimbursement from FEMA. Individuals need to have the proper training so we can get reimbursement. We have got several staff members that are scheduled to take the advanced emergency management classes, and this will prepare us for the future public health emergencies, because we know that there will be future public health emergencies. On November 17, 2021, Dr. Lyons talked about this, was the training that they received on the radiologic emergencies. And it was hosted by the Region 9 Assistant Secretary for Preparation and Response Coordinator, Captain Kevin Sheehan. So they had someone there that really has studied this and came to Carson City to help present. Originally, we had 58 flu vaccination events in October, but that turned into 69 flu events. Most of these events were in collaboration with our schools, and several of them were in collaboration with community members and employers. And we use these again as an exercise of our points of dispensing plans. And we've been doing this for many, many years. I remember even before I came to work for the health department, I did it as a volunteer to assist. So that just tells you how long this has been going on. And every single exercise, we learn something new. Challenges that we're facing right now, recruiting of 2 positions, our health fiscal grant analyst and our clinic services nurse manager. And other challenges are Quad Counties has completely quit using the National Guard to support COVID operations. We do have some challenges with hiring vaccinators, testers to support the COVID response. And Sydney is one of those people that makes this stuff happen. Here is my calendar of events that I give you at each Board of Health meeting. And if anybody is interested in any of these, please contact the person that I've indicated on here. And we are happy to have anybody participate.
I would point out on that last slide, the National Association of Local Boards of Health, the annual conference and the webinars that they have. Those, I attended the most recent one virtually, but yeah, it's good about what's going on local Board of Health activities.
I just want to comment, if any other member of the board, Lisa Schutte and I have been doing the affordable housing. That one is in a discussion mode. So if there's another member of the board that wants to attend that, just let me know. I'll be happy to bow out that meeting or something, or I'll ask Lisa to, because if you're interested, just to understand how it works, just let us know. But we would have a quorum, so please don't just jump on without letting us know in the first place so we can stay. Like I said, I'd be happy to bow out that day, or Lisa can, to let you get a feel for it if you'd like. Just want to, stay on the room.
Any questions?
So I have some comments on the more
On the comprehensive?
Yeah, on the more full
And that's as
report.
an attachment for the public. There's a more comprehensive report that has a lot more
Detail in
information.
it. And the first is to say that the Human Services section in this first fiscal year, because they're reporting data by fiscal year, it appears has helped 52 different households or individuals get or stay housed, okay? And so that's from July 1st. 52 people have been helped, or households or individuals, sorry.
And that's made possible through grants.
Yeah. And then to point out that masking does work, and that can be seen in the influenza hospitalizations in 2019 before the pandemic, and we were all wearing masks. We had 36 hospitalizations due to influenza. And in 2020, we had 2. So those measures for respiratory illnesses, social distancing, mask wearing, hand washing, they do make a difference. Illustrated there with influenza. And the other thing I want to ask, the breastfeeding program, I see here that Carson City had a decrease in breastfeeding at 6 and 9 months, whereas Gardnerville had a marked increase across the board. So maybe Carson City can consult with Gardnerville about what they did different to make breastfeeding happen. And I'm a little disappointed because I would expect it would have gone up. As we know, unfortunately, more women actually stayed home with the kids. So why that breastfeeding wasn't up for Carson City?
Yeah, and that is through our WIC program. And we also do it down in Douglas County.
So it's the same
It could
people?
be, we have an individual that works down there. We have a part-time individual that will go back and forth. And we have a full-time person in Carson City.
Yeah, so
And I
maybe
can-
just,
it
they
could
could
be
sit down at a
just-
coffee clash or clutch or
Well,
whatever you call
yeah,
it.
and they meet.
Did we have
So
fewer
I don't
babies?
have an explanation of that.
Could have just been a function of sometimes
It was the
two clients
percentage,
can
so-
change a number huge because the population is small, so.
Yeah, that might be
right?
what it
It could
is,
just
but-
be a factor of pure number because it's small.
And that will
Right.
definitely be something that we'll be watching.
Yeah, I just want them to consult and
Mhm.
see. And then I would point out good news, and that was at the Nevada Parade, there were over 30 different food vendors, and they were all permitted, but this was more than had been present for several years. So we're getting back to normal.
And I didn't bring it up in my report, but I want to commend you all for doing the moratorium on the cannabis lounges. As you doing that, it actually, I can't remember what the magazine is, I'll find that out, but it was highlighted in a magazine that Carson City did this.
Joke, we could have had it as a health outcome, okay? Right, a health policy.
One other thing I would point out, and then we'll go to, and this is something I don't know anything about, but that cremations for the indigent has gone up by 15%. So I don't know where that contract is or that kind of thing, but if someone might want to look into that, it seemed like quite a price jump of 15%. It would be.
Number of people or?
No,
what?
cost.
We didn't increase the cost.
Yeah, the cost went from $550 to $650.
Oh,
which
we
is-
did that by contract. This board approved
Yes.
the contract increase.
That's
Because they hadn't
ended-
had an increase in, what was it, like 20 years
Yeah.
or something?
Oh,
So we
okay.
finally increased the dollar.
Okay,
Thank you.
I mean, it's
Never
not,
mind. Yes.
for a year, it's like $5,000 or $6,000,
Right,
it looked like, so.
Yes, and that's for the indigent cremation. And yes, that was done through the Board of Supervisors.
And then I forget, any other comments? No, okay. Is there any public comment? Anybody on the phone?
There are no callers on the line at this time.
Okay, thank you. And do I have to entertain a motion to adjourn? I can just do it. Okay, thank you, everyone. I appreciate it. We are adjourned.